There is a small moment that happens in millions of bathrooms every morning, and almost everyone has been taught to misread it. You floss or you brush, and there is a thread of pink in the sink, a little blood at the gum line. The lesson most people absorbed long ago is that this means they brushed too hard, that the gums are delicate and the bleeding is the price of being thorough. So they ease off, or they ignore it, and they go on with the day. The blood is treated as a minor, almost mechanical thing, like a scrape from being a little rough. It is almost exactly backwards. Healthy gums, brushed and flossed firmly, do not bleed. Skin in your armpit does not bleed when you wash it. Healthy gum tissue is no different. Bleeding at the gum line is not a sign that you were too rough. It is a sign that the tissue there is inflamed and ulcerated, that there is, in a real and literal sense, an open wound running along the base of the teeth. And an open wound in the mouth is not sealed off from the rest of you. It sits at the edge of a dense network of blood vessels, bathed in a film of bacteria, opening directly onto the bloodstream. That is the fact this video is built on, and it is stranger and more serious than the cosmetic story we were told. The bacteria that live in inflamed gums do not stay in the mouth. They cross that wounded surface into the blood, every time you chew, every time you brush, and they have been found, alive and identifiable, in the worst place they could end up, inside the plaques that narrow the arteries of the heart. The mouth, it turns out, is not a separate room. It is a doorway into the bloodstream, and a bleeding gum is that door standing open. To see how a problem in the mouth becomes a problem in the arteries, follow the bacteria along the path the body actually gives them. Start at the gum line. Where the gum meets the tooth, there is a tiny groove, and in a healthy mouth that groove is shallow and the gum is sealed tightly against the tooth like a cuff. But when bacterial plaque is allowed to build up and harden there, the body mounts an inflammatory response against it, and that chronic inflammation slowly destroys the seal. The groove deepens into a pocket. The lining of that pocket becomes ulcerated and raw. This is periodontitis, gum disease, and it is extraordinarily common past middle age. What is not widely appreciated is the scale of the wound. If you added up the ulcerated lining of all the pockets around all the teeth in a serious case, the total raw surface has been estimated to be roughly the size of the palm of your hand, a hand-sized internal wound sitting in a pool of bacteria that most people do not even know they have because it rarely hurts. Remotion, fact card title, the periodontal pocket, line, inflamed gum equals ulcerated, bleeding lining line, severe disease, total wound approximately equals palm-sized, Posat lower third, der 5s. Now add motion. That wounded pocket is not static. It is disturbed constantly. Every time you chew, every time you brush, the inflamed tissue is pressed and the bacteria in the pocket are pushed across the broken surface into the small blood vessels beneath. The result is a transient bacteremia, a brief shower of oral bacteria into the bloodstream. And in a mouth with active gum disease, this is happening not once but many times a day, with ordinary eating. The body clears most of it, but the exposure is relentless. A daily repeated delivery of mouth bacteria and their toxins straight into the circulation. Remotion, counter label, chewing and brushing push oral bacteria into the blood, bacteremia, from deriro to 1-1 prefix, post-sac upper third, der 4s, then follow where they go. Researchers looking inside atherosclerotic plaques, the fatty, inflamed deposits that narrow arteries, have repeatedly found the genetic fingerprints, and sometimes the living organisms, of mouth bacteria, including a key periodontal pathogen called Porphyromonas gingivalis. The bacteria of the gum have been recovered from the wall of the artery, and there is a second root that may matter even more than the bacteria themselves: inflammation. Chronic gum disease keeps the body's inflammatory system switched on, raising the level of inflammatory markers in the blood, such as C-reactive protein. Atherosclerosis is, at its core, an inflammatory disease of the artery wall. It is not just cholesterol stacking up, but cholesterol caught in an inflamed, immune-driven process. A constant low fire of inflammation coming from the gums adds fuel to exactly that process throughout the body. It is worth being precise about the two ways the gum reaches the artery, because they are different and they compound. The first is the bacteria themselves. Organisms like Porphyromonas, gingivalis, crossing into the blood and lodging in the vessel wall, where they can directly provoke the local immune reaction that thickens a plaque. The second, and probably the larger, is purely chemical. A body fighting a chronic infection anywhere keeps its inflammatory system primed, and a primed inflammatory system attacks the artery wall more readily, turning quiet cholesterol deposits into active, growing, unstable ones. You do not need a single bacterium to reach the heart for the gums to matter. The inflammation alone, carried in the blood as signaling molecules, is enough to tilt the artery toward disease. That is why the size of the gum wound matters so much. A hand-sized inflamed surface is a hand-sized inflammatory generator running without pause. So the chain is direct, and every link is ordinary biology. Plaque inflames the gum. Inflammation opens an ulcerated pocket. Chewing pushes bacteria through it into the blood. The bacteria and, more importantly, the inflammation they drive reach the artery wall, where they feed the very process that builds dangerous plaque. The mouth and the heart are connected by the bloodstream, with no wall in between, and gum disease is a way of pouring bacteria and inflammation into that shared stream several times a day for years. Set two mouths side by side, doing exactly the same things, the same chewing, the same meals, and watch why one sends a daily stream of bacteria into the blood and the other does not. Take the healthy gum first. Around each tooth, the gum forms a tight sealed cuff, pink and firm, and the groove at its edge is shallow and intact. Bacteria still live in the mouth. They always do. But the barrier between them and the bloodstream is whole. When this mouth chews, the gum presses against the tooth and holds. When it is brushed and flossed, the plaque is wiped away before it can organize into the hardened colonies that trigger inflammation. There is no ulcerated surface, so there is no meaningful breach. Bacteria stay on the mouth side of the wall where the body can manage them. The same firm flossing that makes a diseased gum bleed makes a healthy gum do nothing at all. Remotion, bar chart, title. Bacteria crossing into the blood, bar 1 label, healthy sealed gum, bar 1, underscore value equals 15, bar 2 underscore label equals inflamed pocket, bar 2 underscore value equals 100, pose equals center, dur equals 5 seconds. Now, the inflamed gum. Here, the seal has failed. The pocket is deep and its lining is ulcerated and bleeding. The barrier that should separate the mouth's bacteria from the blood is broken along a wide front. When this mouth chews the same meal, the pressure milks bacteria out of the pocket and through the raw surface into the vessels beneath. When it bleeds at brushing, that bleeding is the visible proof of the breach. Blood coming out means there is an open channel for bacteria to go in. Same teeth, same food, same brushing. The only difference is whether the gum line is a sealed barrier or an open wound, and that difference decides whether the bloodstream is exposed to the mouth several times a day. It helps to understand how the seal fails, because it explains why the timing of cleaning matters so much. The bacteria in the mouth are not the problem on their own. The problem is when they are left undisturbed long enough to organize. Within a day or two, the soft film of plaque at the gum line matures into a structured bacterial community, a biofilm, that is far more irritating to the gum and far harder to remove. Left longer, it absorbs minerals from saliva and hardens into tartar, a rough cemented deposit that grips the tooth below the gum line and cannot be brushed or flossed away at all. Only a dental instrument removes it. Tartar then holds fresh plaque against the gum permanently, like a splinter the body cannot expel, and the inflammation becomes chronic. So the difference between the sealed mouth and the breached one is largely a race against the clock. Disturb the plaque daily before it organizes and hardens, and the seal holds. Let it sit, and it builds the very structure that keeps the wound open. This is why the bleeding matters so much more than it seems. It is not a cosmetic nuisance and not a sign of brushing too hard. It is the single most visible signal that the barrier is breached. The body is showing you the open door. And the gap between the two mouths is not closed by anything dramatic, no surgery, no medication in most cases, but by whether the plaque at the gum line is removed often enough that the inflammation never gets to open the pocket in the first place. The whole of the difference between a sealed gum and a daily breach is decided by what happens at the gum line each day. For a young mouth, the seal is usually intact, and the whole question stays invisible. After about 50, several things shift together, and the breach tends to widen at exactly the age when the arteries can least afford the extra strain. The first is simple prevalence. Gum disease accumulates over a lifetime of plaque and inflammation, and by later life it is the rule rather than the exception. A large share of adults past 50 have some degree of periodontitis, and the proportion climbs with each decade. The gums also recede with age, exposing more of the tooth and the vulnerable junction at its base, and creating deeper, harder-to-clean spaces where plaque can shelter. So the wounded surface tends to grow with the years, often without any pain to announce it. Remotion, call-out, text. Periodontitis becomes the rule, not the exception, after midlife. Posaz, lower third, dur 5s. The second is that the arteries are already under pressure. The same decades that let gum disease build are the decades in which atherosclerosis is quietly advancing anyway, driven by blood pressure, cholesterol, and the slow inflammatory wear of age. Adding a chronic source of bacteria and inflammation from the gums is adding fuel to a fire that is already burning. A steady inflammatory load arriving from the mouth at precisely the time the artery wall is most prone to it. There is also a vicious link with diabetes that matters greatly after 50 because both conditions become common at the same age and each makes the other worse. High blood sugar impairs healing and feeds gum infection, so diabetes worsens periodontitis. And the chronic inflammation from periodontitis, in turn, worsens blood sugar control. The two run as a loop, and that same inflammatory burden is one of the things driving cardiovascular risk in diabetes. So the gums sit at the intersection of two of the most important conditions of later life, quietly amplifying both. For someone managing blood sugar, the state of the gums is not a side issue. It is part of the same problem. The third is how silent the whole thing is. Periodontitis is usually painless until it is advanced. The bleeding is easy to dismiss, and there are no symptoms from the bacteremia or the inflammation it feeds. So the breach can widen for years, contributing its share to the inflammatory burden on the heart, while the person feels nothing wrong in their mouth and never connects the two. It gets noticed, if at all, as a dental problem, a loose tooth, a gum that has pulled back, long after the systemic exposure has been running. And by then, the local damage is its own burden. Advanced periodontitis is the leading cause of tooth loss in older adults, and losing teeth quietly narrows what a person can eat, pushing the diet towards softer, more processed food and away from the fibrous fruits and vegetables that protect the heart in their own right. So the same neglected gum line can harm the arteries twice over. Once through the inflammation it pours into the blood, and again, years later, by taking away the teeth needed to eat well. This is the quiet danger, a common, painless, treatable condition that may be adding, invisibly, to the single biggest cause of death in later life. And because it is treatable, it is one of the few such contributions a person can actually do something about. If the problem is a breached, inflamed barrier at the gum line, then the fix is to heal that barrier and keep it sealed. And the means are unglamorous, cheap, and almost entirely within your own hands. The goal of everything that follows is the same. Remove the bacterial plaque at and just below the gum line often enough that the inflammation settles and the pocket closes. The center of it is daily cleaning between the teeth, because that is the one place the breach lives and the one place a toothbrush cannot reach. A brush cleans the broad faces of the teeth, but the gum line between them, where pockets form and plaque shelters, is reached only by floss or by the small interdental brushes that fit between the teeth. For many people past 50, with wider gaps and receded gums, the little interdental brushes are easier and more effective than string floss. Either works, and the best one is the one you will actually use every day. Once a day, deliberately, clean between every tooth, down to the gum line. This is not about scrubbing the surfaces your brush already handles. It is about disrupting the specific colonies that drive the gum inflammation before they can harden into the tartar that only a dentist can remove. Remotion. Counter label. Clean between every tooth to the gum line once a day, from =0 to =1 suffix equals pose equals upper third, dur equals 4 seconds. Technique matters more than force. With floss, the aim is to curve it around each tooth in a C shape and slide it gently just under the gum line, wiping the side of the tooth rather than snapping it straight down onto the gum. With interdental brushes, the right size is one that fits snugly into the gap without being forced. A dentist or hygienist can tell you which sizes match your spaces, and most people need more than one size for different gaps. The first week or two may produce more bleeding, not less, which is easy to misread as harm. It is the opposite. It is the inflamed tissue being disturbed and beginning to heal, and it settles as the gums recover. None of this needs to be vigorous. It needs to be daily, and it needs to reach the gum line, because plaque left there for even a couple of days is what restarts the whole cycle. Around that, the ordinary measures do real work. Brush twice a day with a soft brush to keep the overall plaque load down, angling the bristles toward the gum line rather than scrubbing straight across. And see a dental hygienist regularly, because once plaque hardens into tartar below the gum line, no amount of home brushing removes it. A professional cleaning resets the surface so your daily care can keep it clean. What is striking is how the body responds when the breach is closed. Gums begin to heal within days to a couple of weeks of consistent cleaning. The bleeding that seemed permanent typically stops as the inflammation resolves, which is itself the visible proof that the wound is sealing. And the effect reaches beyond the mouth. In controlled studies, intensive treatment of severe gum disease measurably improved the function of the lining of the blood vessels elsewhere in the body. Direct evidence that calming the inflammation at the gums eases a burden on the arteries. One honest note is essential here. The strong, repeatedly confirmed finding is that gum disease is associated with cardiovascular disease, and that the biological pathways, bacteremia and inflammation, are real. What is still debated by scientists is exactly how much of the heart risk is caused by the gums versus shared causes like smoking and diabetes that harm both. So this is not a claim that flossing will prevent a heart attack, and it is not a substitute for managing blood pressure, cholesterol, or the other established risks. It is something more modest and still worth doing, closing a genuine daily source of bacteria and inflammation, with a habit that costs a few minutes a day, improves measurable vascular markers, and protects your teeth regardless. If your gums bleed, that is the signal to act, and a dentist is the place to start. The mistake underneath the whole thing is quiet and almost universal. We treat the mouth as a separate room. Dentistry is one set of doctors, the heart another. Teeth are about chewing and smiling. Arteries are about cholesterol and blood pressure, and the two are filed in different drawers. The blood does not keep those drawers separate. The same circulation that runs through the gum runs through the coronary artery, and a bacterium pushed out of an inflamed pocket while you eat lunch is, minutes later, somewhere downstream. There is no firewall between the mouth and the heart. There never was. That is what turns a bleeding gum from a cosmetic afterthought into something worth your attention. It is the body's plainest possible signal that a barrier has failed, that there is an open, inflamed surface delivering bacteria and inflammation into the one bloodstream you have, day after day, year after year. It does not hurt, it is easy to dismiss, and it is, unusually among the things that burden the aging artery, almost completely within your power to fix. There is a kind of relief in seeing it this way once the initial surprise passes. So many of the things that threaten the aging heart are hard to reach. You cannot easily lower years of accumulated plaque in a coronary artery or undo a lifetime of blood pressure by an act of will. But the gumline is right there, accessible, visible, under your own hand every single day. It is one of the few places where the inflammatory burden on your arteries can be reduced directly, cheaply, and immediately, with a habit that also keeps your own teeth in your head for the rest of your life. The body gave you a warning light you can actually see in the mirror every morning. So the next time there is a thread of pink in the sink, read it correctly. It is not roughness. It is a breach. And closing it is not vanity. And not only about keeping your teeth, it is one of the simplest, most direct things you can do each day for the arteries that have to last you the rest of your life. Care for the gumline is care for the artery, because the blood was always carrying messages between them.